doing a nasogastral tube insertion on you just so we can get some medicine and nutrients into your stomach. Is that okay?
Yes.
I'm going to check your ID band. Could you verify your name and date of birth?
John Smith, 2754.
The procedure is going to be a little uncomfortable. I'm just going to try to get through it as quickly as I can for you. Some gloves on. I'm going to put this cup on you. And I'm going to give you some tissues and a bottle of water. And then I'll give you the spacing just in case you need to spit or anything like that. And then first thing I'll do is just measure this tube to make sure we have it in the right placement. And then I would mark this with my marker. And then make sure to lubricate this tip so it goes in easier. Pick that back up. Take a sip of water real quick just so it slows down smooth for you. I'll have you take your head back. I'm going to go ahead and get started, okay? Now that it's reached your pharynx, I'm going to have you take another sip of water and then tilt your head down. Insert the rest of the tube. Okay. Just going to make sure your tube's in place temporarily on your cheek real quick before I do anything else. Are you feeling okay, Mr. Smith?
Yes.
I'm going to check the placement. I'm just going to get some of your stomach contents from here really quick. I'm going to check the pH. pH is 5.5, which would be a normal for your stomach, so it's in the right spot. I'm going to go ahead and put those back in. Now that we verified placement, I'm going to secure this to your gown. That way the bowl tube is facing up and nothing's going to drip onto you. I'm going to place you on your section. And then I'll make sure to turn that on. And then I'm going to just take off my gloves so I can put the correct tape on you for your nose. Apply some skin protectant so that your nose is dried out so the tape will stick better. I'm going to go ahead and wrap this around here so that it's secure. I'll remove this one from your tooth. You doing okay, Mr. Smith?
Yes.
And then lastly, I'm just going to measure the exposed tube. And another way I would just double check placement before we're done today is to send you over to get an x-ray so we can make sure it's in the correct spot. about 27 inches. And I'm gonna just go ahead and start with the removal process. So you have everything here. And before I do anything, I'm just going to school tape your bowel sound so we can make sure it's in the right position. So I'm gonna move these down real quick. Everything sounds good, so we can go ahead with the removal. So first I'm gonna turn off your suction and remove you from the suction. Unsecure this from your gown. Okay. And then I'm going to have you do this, and then it's just going to be a little uncomfortable. I'm just going to try to do it as quickly as possible. Hold your breath. Are you doing okay, Mr. Smith?
Yes.
Dispose of this with hospital policy. And I also would not forget to flush the tube before I remove it, but that is okay. And then I'll dispose of this chuck for you. These out of the way. Now I'll lower you back down. Are you comfortable, Mr. Smith?
Yes.
Okay, your call light is in place, your wheels are locked, and the bed's in the low position. Is there anything else I can do for you before I leave today?
No, thank you.